premieres.
Hello and welcome to The Drama. I'm Ellen Fanning. Coming up, WA snap lockdown will end at midnight tonight, but Premier Mark McGowan is demanding a crackdown on Australians crossing international borders. Meanwhile, India is on a precipice with another record number of COVID cases and a death every 4 minutes in the capital, Delhi. And a tax on your carbon as big polluters look to drive down their emissions could Australia be penalised for its soft stance. Joining me on the panel tonight, lawyer and anti-violence campaigner Tarang Chawla. Good to see you in person.
Good to see you.
In Wollongong tonight, founding director of Nowra, a not-for-profit focused on Aboriginal and child and adolescent wellbeing, as well as managing director of Janabar Child and Adolescent Wellness, Dr. Nairi Brown. Good to see you.
Hello, how's things?
Very good, thank you. In Adelaide, I'm pleased to meet former South Australian Liberal leader and SAS Troop Commander Martin Hamilton-Smith. Nice to meet you, sir.
Good to be with you.
And in Canberra, Chief Political Correspondent and Bureau Chief at SBS, Anna Sanderson. Hi, Anna.
Hello, Ellen.
And you can join us on Twitter using the hashtag The Drum, and we are on Facebook. Last month, Western Australia's Premier pulled off an election victory so complete that the Liberal Party representation in the lower house was reduced to just 2 people. But after ordering a snap 3-day lockdown after just 2 cases of COVID in the community, he is now on the defensive, launching an attack on the federal government in a fiery exchange with reporters.
The Commonwealth does have facilities that were built for these sorts of reasons. Now, I know the Commonwealth doesn't want to do it, and I've heard all the arguments, but basically they don't want to do it because it's risk. We had 3 cases, just so you know. I know the Commonwealth just wants us to take up the slack. I know they want us to do all the work, but we're going to make sure we do it in a safe way. If I can finish what I'm saying. We'll have to recalibrate how many people we can take. I think it will be a reduction, probably quite significant, on the 1,025 because we can't have these sorts of things occur again. Hotels were not built for this purpose. So if I can finish my words. Yes, I am. We're in a pandemic. Millions of people are dying. If you can't go to a funeral or you can't go to a wedding or you can't go and run an athletics meet, so be it. I'll let you speak.
What we do know is that the hotel in which this cluster originated, the Mercure Perth, had already been identified as being of high risk of transmission almost 3 weeks ago.
As I think has been said, quarantine hotels are not designed. These public hotels are not designed for quarantine. So we've had to put in measures to work with what hotels that are not sort of fit for purpose.
So once again, the efficacy of Australia's hotel quarantine system is in the spotlight, and according to the head of the Western Australian AMA, return travellers should have been taken out of major cities a long time ago.
1 in 200 of the positive cases has been leaking out, which is a terrible track record for hotel quarantine across Australia and internationally. So we absolutely cannot say that this has been a success in any regard. It's been a human rights catastrophe. People have been trapped in there and infected with the virus later in their stay on repeated occasions, and we need this to stop right now.
Nori, let's start with you, with your medical training. So we had this Australian who went to India in December to get married, returns April 10 to this Mercure hotel. Now, 2 days before this man returns, WA's Chief Health Officer identified this 1970s hotel as one of the riskiest in WA's quarantine hotels. And 4 days after this man came back from India, the Chief Health Officer wrote to the state government saying, look, you want to close that Mercure Perth hotel and find something else to replace it. But it stayed open and the virus, it seems, travelled through the aircon from the room out into the corridor. So does this mean that hotel quarantine only works so long as nobody's infectious, or is this just one problem in one state?
Oh, so as long as no one's infectious, you hold your breath and you don't touch any surface. So, in terms of closing the gate after the horse has bolted, if it's been identified that hotels are not the most appropriate environment for which we then, quarantine returned travellers or from that state or others, I think that there are other options that are available, whether that be Defence Force facilities, for example. I know that regional and other communities have offered facilities where people could be in relative comfort for the period under which they are in quarantine. If you are going to insist on certain facilities being used, then you need to go to whatever extreme it is to ensure that the people that are there, whether they are staff serving meals or providing security or other services to people ensconced within, that they go to the extremes in terms of their service, in terms of cleanliness, in terms of service of the facilities. But of course, we've had plenty of time to identify and address alternatives. So perhaps that's where our focus should shift. We have very little control over who leaves the country, for example, but we certainly have a fair degree of control over the circumstances and the criteria by which people then return. So whether that's in terms of their vaccination, self-isolation and quarantine on return, which facilities, the costs of those, for example, we have control over that. And we should be focused on the practices, processes and protocols that we do have significant relevant control over. Focus on that and make sure that people are provided with the safest environments, irrespective of they're in quarantine or they're providing care to quarantined citizens.
Because, it's just extraordinary that you would come into hotel quarantine from a high-risk country without COVID and end up with COVID when the government said you will be detained in this hotel so that we will keep the rest of the community safe from you. And one wonders whether or not there might be legal action down the road as a result of this. Anna, can I turn to you? That timeline I laid out, that's not great for WA, is it? Is that why Mark McGowan was so grouchy in that press conference?
Well, we know that there have been these national cabinet meetings, and behind the scenes the word has really been to the state premiers and the chief ministers to sort of lay down the politics and try and get solutions here. So at the same time as we're hearing these kinds of frustrations bubbling to the surface, we know there has been this underlying wish from the federal side of things, certainly, that everybody try and get on the same page. But clearly these frustrations are there because this is happening, and other opportunities, other ways that the federal government could deal with this are just not being further pursued. We know that there have been applications made in other jurisdictions to have those kind of regional facilities built that would be purpose-built, that would in some way block...
Private folks willing to build them in Toowoomba and Avalon. I think we talked about, was that last year? Time seems so strange at the moment. It could have been last week, but it does seem a while ago that we sort of debated
in the last couple of months.
Yeah.
Yeah, in the last couple of months.
Is there any appetite to look at any of that again, given that, you've got this chain of paperwork that's saying, I don't know, there's some positive, negative thing that goes on with air conditioning that means it leaks out of the room, right? And people are filling out these things and emailing them off to the government and going, I got a problem there. And somebody puts it in the next folder over, and then we shut the state down for a couple of days.
It's hard to work out what the actual outcome and reasoning is here, because on the one hand, I think the federal government has said that based on the best health advice, it's not a good idea to take COVID and people who potentially have COVID into the regional setting where you don't necessarily have the health infrastructure and you put a smaller community at more risk. So that argument is there, but then the Howard Springs facilities operating in the Northern Territory relatively successfully. So I think there are two arguments operating here, and that's why there is this frustration. And you're hearing the Australian Medical Association now calling for more clarity, calling for more consideration of those regional facilities, in line with many experts who have said this previously.
Tarang, the other thing that the WA Premier was saying was you're all grounded. That's how he'd have it, that we shouldn't be able to leave for weddings, for funerals, for sporting events, whatever, that we all should stay home. But for many people, this isn't their only home. Is that? What do you think of that sort of What would you think of that sort of directive that says you stay on these shores?
At its kindest, it's wishful thinking by Premier McGowan, that people will be able to halt their lives to the extent that's required. I'm certainly pro-lockdown, particularly when it comes to being able to curb the spread of the virus. I think that often lockdowns are a great way in Australia to be able to give contact tracers the time to be able to get on top of the virus. What the situation we'll probably discuss later in the program that we're seeing elsewhere abroad is that contact tracing can't keep up with the rise in the number of cases. Fortunately, we're not in that position, but the Premier wanting people to just stay put and closing off borders as he did for much of last year, it's not a long-term solution. So I think that the Premier is going to have to look beyond this snap lockdown period and actually think, what are the ways that we're going to make hotel quarantine or whatever quarantine system we use medically sound so that the virus doesn't spread.
And talk to me about how hard is it for your community, for, I don't know, your parents or their friends, not to be able to go to a funeral. I mean, we had that in Australia during lockdown, but then it eases, right?
It eases.
But the notion that, OK, while ever we fix up this hotel quarantine, and we've had a while at it,
Yep.
while ever we fix up this vaccine rollout, and gosh knows how that's going to go, you're going to have to miss funerals and weddings and things, and you never get those opportunities. They're important things to do.
I mean, speaking personally, I've probably I'm now counting on two hands the number of weddings and other events that I would have travelled for overseas, not only to South Asia but to other parts of the world.
Yeah.
And then that's the celebratory aspect. You hope to be able to celebrate later. The thing that really hits home for me is that I've had relatives pass away. I know people who've had relatives pass away in other parts of the world. They're unable to go visit them. If they do go visit them, then they're effectively stranded. They have no means of re-entering Australia. So it's a gamble. It's, do I go and offer my condolences? Do we do the final rites of passage according to whatever one's culture may be? Or do we stay here? And people are doing Zoom weddings. I've attended Zoom funerals, and eulogies are read over Zoom or Skype, and it's at the heart of this virus is a lot of human pain and suffering. And I think that our leaders need to find a way that isn't just putting the blame on other governments or other political parties of other persuasions, but actually collectively working together so that the community can band around a message and actually get on top of this virus.
And Martin, that was what the National Cabinet process was supposed to be about. I mean, obviously there's quite a lot of tension now between WA and the federal government over this issue. I mean, is that necessarily a bad thing?
Look, one thing COVID's done is remind Australians that we are a federation. States have locked down borders, exercised their powers, and reminded Canberra that we're not a union. There's a message in that. I've got to commend Prime Minister Morrison for the National Cabinet idea. But of course, what our leaders have done, and that's the second point, is create a bit of a sense of panic. And they've done that through starting off with a we'll live with COVID approach, but allowing that to morph into an elimination of COVID and an eradication of COVID strategy. So now the slightest outbreak results in lockdowns and people rushing off to the supermarket to buy tissue paper and panic buying. In a way, that's been created by our leaders. So I think my message would be, look, stay calm and carry on. Wherever we put people, whether it's in remote locations, controlled by the Commonwealth or in capital cities in COVID hotels, there will be a risk of it leaking out. I think we need to work together to make sure that we manage those situations when they do occur, and they will occur, sensibly. And that's been done, to be fair. Short lockdown, now it's over. What we can't do is make Australia a prison. What we know is this could go on for a year or two, maybe longer, before international travel is back to where it is. We can't lock Australians up. There's going to be a need for Australians to return, and some need for Australians to leave and then return. You could quibble over what's fair, what's not. Should it be a wedding? Should it be a crisis or a funeral? Sure, let's sort that out through the National Cabinet. But I think stay calm. Mr McGowan sounds a little unnerved by all this. I think just stay calm, get on with it. This will happen from time to time. And remember that, in a sense, we've created this expectation now that COVID won't rear its head. Well, it will rear its head, and we need to get used to that happening. Perhaps, again, it's happening in nearly every state now, and it will happen again.
And Norrie, can I just take advantage of your expertise just once more?
You could try.
So you see that AMA chief in WA saying really strongly that hotel quarantine isn't fit for purpose, that the federal experts advising National Cabinet have got it all wrong, and that hotels can't be made safe for COVID positive people, and we need purpose-built facilities. Do you share that view? And secondly, what's your view on home quarantine? You know, we've had 14 breaches of hotel quarantine. Should we just look at making everyone go home?
Well, I would certainly agree that hotel quarantine, it's not fit for purpose. That's not what they're made for. They're for people to mix and mingle, relax, you know, put their feet up. You know, COVID and other diseases they're an invisible risk, right? So unless someone coughs in your face or licks your hand, you'll never know what you've touched, what you've been exposed to, what you're breathing in. So I think that we need to think about multiple options, and we may need to think about it in a phased or staged and pragmatic approach. So it might be, you know, a stepwise progression to home quarantine if there are ways that we think we can provide, it's not supervision, but, you know, certainly an overarching oversight of people's movements and their exposures and their ability to abide by the criteria and boundaries of quarantine. But if people, you know, I know that celebrities, for example, have been given exemptions to
Are they more trustworthy,
self-isolate at home. So why not, you know, Joe Australian have the same opportunity in a comfortable environment which has everything that they need? I would anticipate that we would then be more likely to want to spend 2 weeks at home than we would sitting in some horrible boxy hotel room where we actually don't know what the risk of our exposure is, who's been there before us, whose exhaled breath we are then inhaling, for example. So hotels not fit for purpose, I would agree. There are certainly better options, and whether they're purpose-built, which will take time and resourcing, or whether in the interim we consider what I would anticipate is more likely to pass the pub test, that people have the opportunity to quarantine at home.
Be interesting to see whether or not there's more of a debate around this in National Cabinet in coming weeks. For the 4th day in a row, India has set a record for the number of new COVID cases in a single day. Almost 350,000 infections were reported overnight and more than 2,500 deaths. In the capital, Delhi, one person is now dying every 4 minutes. The international community has responded with the UK and EU sending oxygen, ventilators and medicine, and perhaps more significantly, the US will send the raw materials needed for India to manufacture the AstraZeneca vaccine. But the situation is worse than at any point in the pandemic. Hospitals have run out of beds and oxygen supplies are dwindling. And a warning, you may find images in this report disturbing.
India's being called a devastating reminder of what the virus can do.
There was no oxygen. My mother died in agony.
We were not prepared. As a country, we were not prepared.
There are almost 20 times more cases now than at the start of March.
The front line, an emergency room in a COVID hospital. Just about standing under the weight of an unfolding disaster.
Running out of oxygen. The whole country is running out of oxygen, okay?
We've already been to 5 hospitals. Where will poor people like us go?
Families are getting increasingly desperate. With no beds available, this man blocks traffic in a plea to staff to find room.
The intensive care unit is full too. There are next to no ICU beds in a city of 20 million.
At times we feel like crying because we are not able to help patient properly.
The government in some ways failed in estimating what was going to happen.
Government is a literal failure. A person cannot live here in Delhi. A person cannot even die peacefully in Delhi.
There's a strong feeling in India that this disaster could have and should have been avoided.
Huge religious gatherings and political campaigns, which even feature the Prime Minister gloating about crowd numbers, have fuelled resentment.
We have to save the country from another lockdown. I would also like to request states to only use lockdown as a last resort.
In Varanasi, funeral pyres are lined up on the banks of the holy Ganga River.
They're dying like animals, he says. We don't even have enough resources to cremate them properly. There is a sense of abandonment in this country. Citizens are stepping up to do what a government should, left to fight a vicious pandemic on their own.
For more on this, we're joined by CEO of the Indian Link Media Group, Pawan Luthra. Thank you so much for coming in.
Thank you, Ellen.
It's just impossible to describe the breadth of suffering. You're at 1.4 billion people. This is a catastrophe.
It is. Look, I was watching your faces while the video was playing, and it's absolutely gut-wrenching seeing the photographs and the videos of people who are dying on the streets, gasping for air, ambulances overcrowded, the hospital system totally broken down. It's a heart-wrenching scene, and the challenge is that it's not over yet. I think there's going to be quite a few more of these scenes which will eventuate over the next few months as the virus spreads more in India.
Yeah. And when you think about, you know, the funeral pyres that are having to be built like that to deal with that amount of victims of this virus, but also the fact that 350,000 people today got COVID. What does that mean for long COVID? What does that mean for this vibrant country that you might have a health catastrophe of a generation here?
Look, it was a difficult challenge for India when the virus hit because of the high density of the population. So it was pretty clear that if this virus takes hold, it's going to spread. And also the social systems where there would be the poverty trap. Do you lock down the cities? Do you lock down the country? Because there's no social structure over there. And people need to be out there earning their daily wages. And I think the catastrophe is going to get bigger as issues of poverty, of unemployment, of hungry families is going to explode across the nation. So it's going to be quite challenging in the near future. In fact, I'm getting about 400 to 500 messages a day from my friends and family. At Indian Link, we're getting about 30 or 40 messages, and all the people are asking the same thing. Can you help us get a hospital bed? Can you help us get into ICU? Can you organize oxygen tanks for us? And where do I get medicines? And Ellen, these are the people who can afford to call up, who have friends overseas, who are people of influence. But what about the unfortunate millions who have no access to any proper healthcare system? The public system is totally broken. It's an economic and a medical disaster which is unfolding right in front of our eyes in 2021.
Tarang, there's a sense that it didn't need to be like this. I mean, the first wave that went through affected urban slums, and it seemed to be confined to there, and India got it back under control. And there was a lot written about that, about how that happened. And then there was this lull, but it seems the government didn't prepare, didn't get more ventilators and more oxygen. And in fact, Modi has promoted people on this key day of April 14, Hindus to go to this massive festival, Sikhs to celebrate New Year and Muslims to celebrate the start of Ramadan at a time when the infections were ratcheting up. Why would he have done that?
Well, he's a populist leader, isn't he, Ellen? He's someone who understands that his base and that many people across the Indian continent are deeply religious, that they do observe these religious festivals, these customs, and he understands that by enforcing a lockdown again, that they're not necessarily going to see him in the same light. So what's happened as a result of government complacency is that the virus has spread outside of those urban slums into the burgeoning middle class of India. And we're talking about hundreds of millions of people. We're talking about cities like Delhi of in excess of 20 million. And to put these numbers in context, you said during your introduction, Ellen, that there's one death every 4 minutes. That's 15 people during the course of the program that will die from COVID. The numbers that we know about in terms of, it's 300,000 a day that we know about. Testing in countries like India is not watertight. You know, reporting standards, we've struggled when we had the outbreak in Victoria where I'm based, and we were dealing with, you know, world-class health system. We were dealing with some of, you know, preeminent minds working on it. We still struggled. You know, and so you put that into India's context. This is what we know so far. It is a humanitarian crisis unfolding before our eyes.
Look, Ellen, the handling of COVID-19 has been complacent at best and callous at the very worst. The government started tweeting in about mid-February that they have control of the virus, we have won the war, let's move forward. And then they allowed 2 super spreader events to go ahead. One being a big religious gathering in April, where there were about 3 to 4 million people who gathered in a very confined space. No social distancing, no masking, no hygiene issues, nobody getting fined.
And that's where we saw people going into the Ganges. That was
exactly.
That Hindu festival.
And that just got concluded. And what's happening now, all the holy priests and the men who come from small villages in India are now finding their way back to the small villages. And that is what worries me a lot, because this is going to just explode from the bigger cities into the smaller villages, into smaller towns, where there will be limited healthcare, limited medical facilities, and that will be a big problem going forward. And the other one was the calling of an election in 4 states and 1 union territory of India, where there are more than 200 million voters to be wooed. And again, the Prime Minister was busy tweeting, saying that his gathering has got the most amount of people turning out.
So this is Trump-style rallies in West Bengal.
Exactly.
Right.
And there were hundreds of thousands of people at this rally, and again, a super spreader event. And then the messaging is not getting through because the government had no message to pass on. And then the third layer of society which needs to be blamed is the arrogant rich, because sometime in February, March, they thought it's all over. Right. There were massive weddings. And if you've been to an Indian wedding, we're talking about 2,000-3,000 people at one go. All the parties had started. I've heard anecdotal evidences of fake COVID certificates being shown so that they could travel around the country. So there was no protection for the lower class who had to go out and support any of their daily livelihood. So the messaging was totally lost. So it's a challenge which India is going to face in the next few months as the curve keeps on increasing. It's not going to flatten for quite a few weeks from now.
Let me go to the rest of the panel and we'll come back to what the community here is doing and what might be done. Nari, let me just go to you really briefly. 83% of the shots, vaccine shots that have gone into arms have gone into high and upper middle class countries, right? Only 0.2% have gone into arms in low income countries. India is vaccinating about 3 million a day, which is 0.2% of their population, which is probably fewer people than are actually getting COVID. So would we imagine then that that becomes a threat to India and to the world more broadly, because presumably at that rate, with that many people getting it, it starts to mutate and you're dealing with a different threat. Is that right?
Well, you anticipate that that is the case, and we already know that there are several nations within which we have identified specific strains. The UK strain, the India strain. Can I just say that I'm actually surprised and disappointed that, in fact, it's taken this long for this to come to our attention and the attention of our media. We have one of the most populous nations in the world with existing significant disparities. They have complex social, cultural and political systems and environments, and finite health resources and public health capacities. So in that context, every day is a super spreader event. So, you know, it's a global pandemic, and it was named thus for a reason. It's not just a local issue or significant to any singular particular nation. And we have a responsibility then to be able to, or to make attempts to contribute to the global response. I think that we have more than enough resourcing, for example, to be able to support populations that have lesser resourcing and lesser access to essential prevention, if that makes sense. And if you have countries whereby there is significant movement, significant disparity, lack of access to appropriate care in a timely manner, then yes, they are the populations within which strains bubble.
Yeah.
They are transmitted, as has been mentioned. Larger urban, populations move to regional areas and back to family, and they take with them, whether they're symptomatic or not, those various strains. So the risk of that is actually quite extraordinary.
Yeah. Anna, there's a proposal from the World Trade Organization to temporarily waive some intellectual property rules for medical products so that countries like India can make and sell cheap copies of vaccines that were invented elsewhere. But there's a catch. Have a look at this map if you can. The countries with the power to waive these intellectual property rights, the United States, the UK and EU, and yes, Australia, those countries in orange are refusing to support it. So in other words, what we're saying, Anna, is that the shortage of vaccine that India is experiencing is artificial. It's only a shortage if you respect the intellectual property rights, that somebody else owns it and has to license it for use and oversee it. If you say, all bets are off, here's the recipe, have at it, you really can put a dent in this problem. Why would Australia be standing in the way of that?
And I can definitely not answer that question, in the sense that I would love to know the answer too from our public health officials. At this stage, Ellen, we know that the Health Minister, Greg Hunt, has said today that there's going to be a meeting of the National Security Committee of Cabinet tomorrow. They're going to be discussing how to get more oxygen tanks and other support to India. But on that bigger question about vaccines, you've got to think that there's going to be increasing pressure on those world powers. There is and has always been some discussion about whether or not removing some of those restrictions could lead to vaccinations that aren't necessarily at the appropriate standard. Now, I don't know how much we can garner at this point about whether or not that stacks up and continues to stack up as an issue, but that has been one of the arguments on this front. But certainly when you look at the absolutely harrowing scenes coming out of India that have been on our screens, and there hasn't been enough coverage of it, but also the Indian government wasn't being upfront about what was going on either. Only a few weeks ago, they were offering vaccine supplies to PNG to help with the issues there.
India was, yeah.
Absolutely. So we do have to do better in media terms as well in covering these things and trying to bring to light what's going on in these huge nations where, as we're seeing now, once this pandemic catches hold, the results are just so traumatic.
Martin, it does seem extraordinary, doesn't it, that the WTO is saying we really won't have a shortage of vaccine if we just temporarily waive those intellectual property rights and say, for medical products, and say, righto, make your cheap vaccines and have at it. I mean, you've been to plenty of trade missions. There's all sorts of reasons, humanitarians, strategic reasons that you might want to look at this. What's your view on it?
Oh, look, it's heartbreaking, astonishing that leaders around the world aren't finding solutions more quickly to help India, and the issue of vaccines is probably the area where we can be of most use. I suspect the problem is far worse than is reported. I think we need to count the fatalities rather than the reported deaths to get a true sense of how bad it is. And can I say, look, I've spent a lot of time there, both privately and involved in trade missions, including in a lot of slums and low socioeconomic areas. The thing that strikes me about India is a lot of people there are living from day to day. If they don't work today, they don't eat today. And lockdowns are the luxury, they would see it, of wealthy nations. You can't lock down a country like India for very long. People will starve. So the problem sort of is accentuated by that dynamic. Can I just also add, all of we Australians need to recognise that India is a really important friend and a really important partner for us, and is going to be for decades and decades, for the foreseeable future. And we need to be helping. And it would seem to me whatever we can do, whether it's freeing up the red tape around vaccine provision and providing them with vaccine, or any other help we can provide, we need to be doing it.
I think you made the point to Garda earlier today, Martin. China is like a Ferrari belting down the road, looks shiny, might crash. India is like a bus rattling down the road that will go on forever. And we need to be aware of that strategic partnership and use our heads and our hearts. Pawan, what did you want to make a comment on the vaccines?
I believe India did have the license from AstraZeneca to manufacture vaccines in India, but the raw material supply got held up by the US government. And it's only today there's been some announcements about releasing raw material for India to start manufacturing more and more of these vaccines. So there is positive movement at this stage. The world is getting together to help India get through this crisis.
And would you like to see Australia do any more?
Well, I believe there would be some announcements coming through in the next 24 hours with the government releasing more ventilators, more oxygen concentrators and other medical facilities which can help India. In fact, what's happening in the local Indian-Australian community is the community is galvanizing into the efforts to start gathering funds so that they can buy this equipment from Singapore and airlift them to India. In fact, the non-resident Indians, not only in Australia but in other parts of the world like US, are starting to build up a war chest of a few $1 million to buy things to help the Indian system get back on its feet. They have realized they're not going to get too much help from the Indian government, so they need to do it themselves. But I also believe the Indian government is heard by what they are seeing, and they will start galvanizing the efforts along with the Indian corporates to start tackling this situation head on. India has got an amazing record that when they put their heads together to achieve something, they will. They eradicated polio, which was a big issue in the country. And I think now tackling COVID-19, getting the vaccine out, helping people will be on war footing. It might take a few months to filter through. And as I said earlier, there would be some heart-wrenching stories and images which we would see. But at least it's in laser light focus of the communities around and the governments around the world to help India.
And Tarang, I did want to say, you've got a cousin in India who's been diagnosed with COVID in the middle of last week.
Yes.
How's she going?
Not well, Ellen. She's she's reporting a fever. She's weak. She's a woman that lives with a disability as it is, in her mid-30s, and has severely compromised quality of life as it is. And this is what we're seeing. We're seeing the middle class being affected en masse. She's confined to her bedroom at home. And much like what we were discussing earlier, she contracted it from one of the maids who obviously contracted it from one of the other maids, and they live in very close quarters together. She was deemed ineligible for the vaccine because of her age, but had she lived in Australia, she would have been quite high on the priority list with all of her pre-existing health conditions. And the one thread throughout all of this is the vaccine. You know, Australia can do a lot in terms of the non-resident Indian community raising funds. We can do a lot in terms of media reporting, but ultimately, if we don't lift this intellectual property ban on vaccines, if we don't find ways to support India, because Indians are very resolute and they will find a way through, but not while they can't manufacture the vaccine. They're able to do so. They have the means to produce it. So we really have to step up and help. It's not enough, in my view, that the Prime Minister talks about what a friendly relationship he has with Prime Minister Modi and what a friendly relationship we have with India, if we're not actually going to help a friend in time of need.
That's right.
I do. We all have your cousin in our thoughts. I mean, it's shocking. Imagine sitting in your bedroom. You're on, what is she, day 4 or 5?
Yes.
And you've got to wait until that second week and see how you go, and there's no help out there.
And there's no help, and it's one of those situations where those with means are the ones that are able to make the phone call, but there's nothing for them. There are no ventilators.
Pawan, thanks so much for coming in and talking to us. Pawan Luthra is the CEO of Indian Link Media Group. You are watching The Drum, and with me on the panel, lawyer and anti-violence campaigner Tarang Chawla. In Wollongong, founding director of NARA, Dr Nairi Brown. In Adelaide, former South Australian Liberal leader and SAS Troop Commander Martin Hamilton-Smith. And in Canberra, chief political correspondent and bureau chief at SBS, Anna Henderson. For many veterans, this year's Anzac Day was particularly poignant. There's the recent decision to withdraw troops from Afghanistan, ending our longest ever war. 39,000 Australians were deployed there over the 20-year campaign. Then there's the announcement of a Royal Commission into veteran suicides, shining a light on the mental health crisis that's touched generations of defence personnel. Among them is former Army medic Talisa Papamau. She experienced post-traumatic stress disorder, PTSD, after serving in Afghanistan. That pushed her to start a social media platform, Modern Soldier, to help others in her situation. Talisa spoke to the drums, Stephanie Bolci.
I think one of the saddest things about veteran suicide is that they survive the war and they serve their country, and then they are affected by their service to a degree in which they eventually go on to commit suicide. I think you serve your country because you believe in it, you believe in an ethos, and you believe that the most difficult parts of that service will be when you're deployed. When you know people who have suicide as a result, it does make you feel very much like your service has been in vain, and it does make you feel like you wish you could do more. My name is Talisa Papamau. I'm the founder of Modern Soldier. I'm a combat medic who served in the Australian Army, who deployed to Afghanistan. I served for 7 years and was medically discharged for post-traumatic stress disorder. So medics deploy with the troops, and they build really strong relationships and close relationships. And you know that you are the last opportunity that a soldier may have to return home to his family. Unfortunately, when their injuries are not survivable, you are impacted greatly, and you go through a grieving process just like anyone else. I certainly had a lot of really difficult times. I think in a way, seeing other Australians lose their lives, it did sort of give me a reason to want to continue. One of the things that I did when I was first diagnosed with post-traumatic stress was to go about and try and research and learn as much as I possibly could about the condition. Eventually, I decided that, well, if this information helped me, then perhaps it could help other people. In 2016, I started a social media network called Modern Soldier, and certainly what people would come forward and say is that, you know, they really appreciated having someone with lived experience explain health-related information to them in a way that they could understand. People have got to be willing to feel like they can come forward in a way where they won't be judged and where they will be supported. We know that 1 in 2 veterans meet the diagnostic criteria for a mental health condition just 12 months from leaving the Defence Force. You know, it's not just a job, it's not just a career, it's a lifestyle. You're not just giving up your career and your lifestyle, you're giving up your friends, you're giving up people who have a shared experience. I think that combined with a culture of just wanting to push through and sort of maintain the operational tempo did lead to worse mental health outcomes. There has been some effort from Department of Defence to try and improve veterans reaching out and try and encourage people, but I'm also aware that there are people in the community that feel that there is a long way to go. The issues in the community are very well known, and some of these include more preventative models of healthcare, faster access to healthcare services, treating veterans and families as a whole. These are all the sorts of themes that I think, if were addressed and addressed quickly, and certainly before the Royal Commission was completed, we would start to be able to improve the lives of veterans and hopefully have an Anzac period where the veteran suicide issue is not looming above the community.
And Stephanie Bolci put that piece together. Martin, can I start with you on that issue of the Royal Commission? You know, with the announcement of our troops withdrawing from Afghanistan back by September, we remember that 20 years cost 41 lives, but 10 times that number were lost to suicide. What do you think? We've just heard that maybe we know some of the answers. Do we need to wait for a Royal Commission to hear them?
Well, first of all, this is a problem our nation's been dealing with for well over 100 years. A population of just short of 4.9 million people during World War I sent 390,000 young people off to fight in Europe. Nearly 60,000 died. Nearly 2/3 of that number were casualties. There was nothing for them when they came home except fellow veterans who understood like that remarkable young woman you've just shown to us, a veteran helping a veteran, and actually their mothers and their wives, their families. There was no support back then, and cemeteries around Australia were full of young men who ended their own lives in the 1920s and the 1930s. So this isn't new. We've gotten better at it, but clearly we've got further to go. Now, our more recent veterans, our younger veterans, first of all, let's not think that all of them have a problem. For a start, to get into the military, you need to be physically, mentally and emotionally pretty strong. But everyone's got a breaking point, and we need to find a way to help those who are on the edge. I think the Royal Commission will help. There's been a bit of resistance about figures anything up to 100 million being spent on such a commission when veteran services, such as you've just shown us, need support as well. What we need is some recommendations that are backed up with funding from the Commonwealth and from the states. And what we need is not another glossy report that sits in the corner and gathers dust. So I'll be looking for recommendations from the Royal Commission that are actually meaningful, and in particular the wonderful people we have at DVA, the Department of Veterans Affairs, who are reaching out to help, and other organisations from within the veterans community actually need some resources. They need more money and more resources so that veterans aren't waiting for their claims to be dealt with for a year or more. Their claims are dealt with sooner. So I'm looking for practical, tangible things that can help. And you know what? Just like back in World War I, it'll be fellow veterans that help them the most, and their families. And so whatever support we provide needs to be done probably through those two devices.
Yeah, and interesting, Martin, I'll be looking out for whether or not, like the Royal Commission into Institutional Abuse of Children, there's a sense of urgency, right? Let's not wait till we've heard all of the evidence. Let's not we've heard all the witness statements and done that important public work of consciousness raising that Royal Commissions do. Let's do an interim report and get some recommendations out. So a really interesting thought about, you know, how a commissioner would run this and what timetable would they run it to, because we've seen good and bad Royal Commissions in this country, and it sometimes comes down to that, as you'd be well aware. Let me introduce another voice into the conversation. Mark Wales served as a troop commander in the Special Air Service Regiment, as Martin did, completing 4 tours of Afghanistan between 2007 and 2010. He knows the cost of war more than most, and he's spent the past 9 years rebuilding his life and career outside of the ADF. He's captured his journey and recovery in a new book titled Survivor, Life in the SAS. Mark Wales, welcome to The Drum. Thank you so much for joining us.
Evening.
Wow, how to start with your story, sir? What an extraordinary story you've got to tell. You write that you thought you'd die in a cornfield in Afghanistan when you saw your mentor gunned down. I mean, I know it's a heck of an initial question to ask you on national television, but can you tell me what happened that day and what it did to you?
Yeah, I waited a long time to train and join the military and become a soldier, and faced my first combat mission about 11 years after roughly 11 years after joining, and one of the first missions we did was in the Chora Valley in Afghanistan in 2007, and it was a clearance of the valley. We got into a very heavy bit of combat, and that incident occurred, which I just mentioned, and it left an indelible imprint on me. I finished that tour, I returned and did 3 more tours, and I think that period of my life was a tough one, but I was glad I was over there, and I guess it took me a long time after leaving the military to process all that and to rebuild my life and move on with things.
You describe in the book the enormous amounts of weaponry that you were carrying. The snipers were covering you, gunship, helicopters in the air, but they were sort of useless in the end when you were ambushed and your lead patrol commander, Sergeant Matthew Locke, was killed. In fact, the first Australian casualty to die by enemy fire since the Vietnam War. And you write that when you got back to base, you said, this place isn't worth it.
Yeah, I can remember returning from it and thinking how surprised I was that in close combat, a lot of the advantages we enjoy as a Western military can be nullified. And it was a pretty tough lesson in, I guess, in fighting, that sometimes technology and all the things that we have as an advanced country matter less than a strong sense of purpose and a willingness to fight hard for something you believe in. So that caught me by surprise as a young soldier.
But you also write very openly about the fact that you kind of gave up, in a sense, on the idea that you were there to win over hearts and minds. You write that we lost an aimless war in Afghanistan. 5 of the 6 districts in the province where Australians were focused are now back under Taliban control. So at what point did you think to yourself, we shouldn't be here, or that there's not a real purpose in being here?
Well, for many years it hung in the balance, and I think for me the first real signs of issues were kind of 2009, when the discussions about the surge were being had by the US government, and it became clear to me there was a bit of a divergence between what the military wanted to do and what the political level were willing to engage in. And I think that divergence is what caused me a bit of alarm, because I knew that if you don't have that will, it's going to be hard to do. And it was a difficult war to engage in, full stop, just the nature of the terrain and the people and just how vast the scope of the mission was we were trying to achieve. It was a really tough thing to try and pull off. So I think as we got further into that surge period, I realised this probably isn't going to end the way we want it to, because we're not effectively resourced for counterinsurgency. And to be honest, it's probably not a mission profile or a strategy you want to follow anyway.
Yeah. You talk about the impact of that on you, of 4 tours, when really under the rules prior to Afghanistan, no way should you have been there in 4 tours like that. You should have been rested. You talk about the blaze smouldering away in you every night. Do you feel like the SAS was sort of misused by the powers that be in Afghanistan?
I think it was convenient to use special ops forces because they have a high impact. They're small footprint. They're really effective. They're well trained. They don't take on as many casualties generally, and I think that trend continued for much longer than it was useful for. And I think the special ops task group ended up shouldering a pretty high level of combat. And I think that is expected for a period of time, but you know, a decade or 12 years is going to be too long for people to sustain. There were a lot of people going back for a lot of tours, and the probabilities of things going wrong or issues or mental health issues increase over that period of time.
Martin, do you agree with that? It came out in the Brereton report. The reliance on special forces by political and military decision makers contributed to a wavering moral compass and to declining psychological health. I mean, we must stress that Mark didn't witness any war crimes, but he has written that killing became incentivised and a toxic culture grew up.
Yeah, no, I agree with everything Mark said. There's a real question as a nation that we need to ask ourselves about whether we should have lingered on in Afghanistan, having eliminated Afghanistan as a threat for terrorist attack upon the West. Was it time to go much sooner? And that point's been made. We allowed ourselves to try and get into a strategy of turning Afghanistan into a peace and freedom-loving democracy. I'm not sure if that was wise. Other nations have tried it in history and failed.
But Mark writes, you know, he says, we pushed our special forces into more than 1,500 contacts with the enemy over 8 years. That's 3.8 per week for 8 years straight.
Yep.
And suspended the rule, the defence signed waivers to get around its own rest policy. I mean,
yep.
was there a sense among the veterans? You've been in the SAS. You've been a Minister for Veterans Affairs. Was there a sense of inevitability that you were just going to break people?
Well, I think so. And not only that, take the Brereton report. We've been told of a lot of accusations that have been made without having heard from the defendants and the accused, who have a right to make their case. And I'm sure many of them will raise the same points that have just been raised by Mark. We put our people in terrible situations when we send them to war. And by the way, again, this is not new to us. This happened in World War I, it happened in World War II, it happened in every conflict we've been involved in. We put our young people in these shocking positions, and things go wrong. Things, judgments fray, pressures on people lead to outcomes that shock people. And we did it again in Afghanistan, and we need to stop and have a rethink before we expose our young men and women to these wars that can't be won, and overwork, particularly, as has been pointed out, a particular part of the Defence Force, Special Operations. Some of our people in Special Operations in Afghanistan probably had more frontline shooting time than some of our soldiers in World War II. Wow. Because it was continuous, it was constant, and it was repeated. In World War II, there might have been gaps in between fights. It was terrible pressure.
We're nearly out of time. Mark, tell me, did you were diagnosed with some issues? You write that there were units where people were burnt out. Did you feel that you were burnt out and that you didn't want to say, I can't go back?
Yeah, it was definitely some burnout. I think you've got to play hurt as an elite soldier. You've got to be able to kind of push through some things. But there is a point, obviously, when those issues become long-lasting. And for me, after my first tour, I pushed through 3 more tours after that, after getting help. But by the end, I was basically burnt out. So, like I was saying, I think you can push soldiers hard, and we should be expected to do exactly that. But chronic overuse in what eventually became a war of choice, I don't think was smart.
Yeah. Nori, I know that you served in the Navy Reserves. You were assisted through medical school through a Defence Force scholarship. What do you think, just very briefly if you can, about that notion of just sort of suspending the rules for rest periods for these elite soldiers?
Well, the processes and protocols, which the ADF love otherwise, are there for a reason. And so despite our knowledge of the risks and impacts to mental health, to our Defence Force men and women, we don't do enough to prepare, to protect, to support or to repair them, particularly when they've been in circumstances of conflict and crisis. So, and we know that the impacts of those traumas and exposures aren't just direct and individual, but can be intergenerational and affect much more than just, the soldier. So if we are going to expect our servicemen and women to serve in extraordinarily difficult environments for any period of time, then we also have to understand the limits of human physicality and mental health and emotional well-being, and make sure that we have every protection in place for them to get them to get them ready to serve, to support them during that service and make sure that they are well supported on return in the context of family and community.
And we're going to conclude. Yeah, we're going to conclude tonight, Mark, with some beautiful photos that you took on Anzac Day. There you are, marching with family. Yesterday, certainly a difficult history in Afghanistan, and interesting account of what it was. Not only very difficult, but some of your finest hours there. Thank you for your service and your time tonight. And if you're a member or former member of the Defence Forces or a relative in need of support, Defence Family Helpline 1800 624 608, Open Arms 1800 01 1046, and of course Lifeline 131114. Our thanks to the panel and all our guests. I'll